underline it, whatever the case. So with this, you want to ask for allergies. Very important. Oh my god, and that goes with any kind of antibiotic. Ask for allergies, but because you can have what's called potential anaphylaxis reactions. So if the patient is not sure if they are allergic to the penicillin, this is a big NCLEX tip, and that's why I need you to definitely double star or underline this. For the NCLEX, you need to clarify this first before administering the medication. It's very important and very crucial. Another one you need to underline in big star and pay attention to is cephalosporin, because you can have what's called assess cross allergy. So assess for cross allergies with this one, because they might also have an allergy to penicillin. So be careful with this one. Okay. Then sulfa. So I want you to think of the sun. Okay. So just like with the doxycycline, the tetracycline, sorry, you can also get what's called photosensitivity. So please be careful of the sun. Watch out for rashes. Okay, an example would be your back trim, which I've seen. I don't think I've ever seen like a photosensitive or a rash whenever patients are sick. I don't think I've ever seen it in my life, but it has happened. So that's why we're talking about it. Okay, then vancomycin. Please, huge, again, star, underline, triple line, whatever it takes for you to remember this, okay? So with Vanco, I need you to write down red man syndrome. Assess for that. So I'm going to give you the symptoms of the red man syndrome. So that's flushiness, flushing, itchiness. I don't know if I just created words, but they're separate words anyways. Flushing, itchiness, warmth, redness, and hypotension. So when that happens, you don't just stop the Vanco. You're going to slow down the infusion, okay? Slow it down. And then the bonus one I want you guys to also be aware of is rifamycin. So it may not sound familiar as it's coming out of my mouth, but you've probably seen in different nursing questions, whether it's your Q banks or ATI or even your nursing questions. So with this, I want you to think red. R, rifamycin. The beginning letter is R, and then red, beginning letter R. Think of that, and then you will be able to answer these questions. So listen closely when I say this. Patients are going to have orange fluids, like orange urine. They could be crying orange tears. So you want your patient to avoid contact lenses or glasses while they're on this medication. Okay, so I hope all of those make sense. Rewind the video as many times as you need if nothing was made clear. I hope all of that makes sense to you. But yeah, I'm gonna go over. So I've already gone over the cardiacs. I've done the insulins, and I'm doing this one. The next high yield one, the last one in my series, I'm going to go over psych meds, because those are very important. Those are probably one of your most asked high yield questions that you'll ever get. So most people tend to sleep on psych. Don't sleep on psych, because those are very important, and it tests for your psychosocial piece when you're taking the NCLEX. So if that helps. And this is my camera, and hopefully this uploads, and I will get everything ready as much as I can. Sorry, I'm shaking because I'm on my bed. Anyways, have a good night and take care. Bye.